New videos every day.
Psychetruth. Life, wisdom.
Hi, I'm Jen Hilman, and today we're continuing our discussion of Swedish versus deep tissue techniques. And today we're going to be looking at massaging the back. So I'll show you some really great techniques, both Swedish and deep tissue, to work into the tight places where a lot of us hold tension. And I've already started by applying some oil to Corrina's skin. You can use any kind of oil that you like. And I'm starting with some long, smooth Swedish strokes to smooth the oil over her skin and start to warm up the muscle tissue. And we can start here. You can continue these strokes a few times as it starts to help your partner to relax and also helps to increase the circulation. And as we get started here, I'd like to ask you guys, what is your favorite movie you've seen? There have been a lot of new movies coming out, and I'd like to know, what's your favorite? What do you recommend going to see? Moving on to another stroke, we'll use the flat parts of your knuckles as well as the heel of your hand to apply a broad pressure covering a lot of surface area, moving along the spine, working into the erector muscles. So these are all Swedish techniques that are geared towards improved circulation, warming the muscle tissue, and increasing relaxation. These types of techniques are very soothing to the nervous system and help our bodies to start to slow down. Now I'm going to shift my focus to one side. Using my thumbs, I'm massaging across the top of her shoulder. And this is going to allow me to take a little inventory and notice where her muscles are tight and where those knots are. This is going to inform where I need to do the deep tissue work later. You will oftentimes find knots in between the shoulder blades as well. So you can use your thumbs again with a flat, broad pressure, just surveying the muscle tissue to see where the tension is being held. Now that I have an idea of where her knots are, I'm going to start utilizing some of the deep tissue work by going into those knots with my thumbs. I'm leaning in with my weight and making small circles around the tight tissue to allow it to gently and slowly start to relax. So deep tissue is a technique that refers to accessing the deeper layers of muscle tissue. It doesn't necessarily mean that you're using tons of pressure, although you would typically use more pressure than in a Swedish technique. Moving back down between the shoulder blade. I'll locate those knots. Here's one area where she's got a little tension. So again, I'm using my thumbs to isolate that area with small circles or some back and forth friction. These are both ways to help break up the bundles of fibers that get stuck together. So if you imagine when you're cooking spaghetti and cooking noodles like that, when they're not completely cooked all the way yet, sometimes the noodles all stick together in a bundle. That's kind of what it's like when you get a knot. Your muscle tissues, the muscle fibers, are all bundled together, and sometimes they get stuck together. So in this deep tissue work, you're using your thumbs or knuckles or other tools to help break up those bundles of muscle fibers. So going back to the flat, broad surface of my knuckles, I'm just going over the area that I just worked. This is, again, bringing more circulation into the area, which will help detox the system. When we work into the deeper layers of muscle tissue, sometimes toxins and things get released out of the cells and get released into the bloodstream. So going back to the Swedish technique helps to improve the circulation and helps the blood to cleanse and detoxify. And as I move further down her back, I'm going to take some time to see what's happening in the mid-back. So this is the thoracic part of the spine. It's the area where your spine has that upward curve. For most of us that spend a lot of time sitting at a desk or in a chair, in a car, we spend our time hunched over. And so this thoracic part of the spine can become very tight. So now I'm using the heel of my hands to utilize a lot of pressure as I alternate going back and forth, one after another, massaging into these tight muscles along her spine. You can also use your thumbs if you notice an area where there's some specific tension. And I also like to use what is called cross fiber friction, where you use your fingertips and just like strumming a guitar chord, you glide your fingers back and forth along the length of the muscle fibers. So here's where it feels the tightest for Corrina. So I'll just focus a little more attention here, utilizing a little more pressure to really work in there and break up those tight muscles. And then I'll come back to using the heel of my hand to smooth it out. And I'm continuing to make my way down her back. And we'll start to work into the low back. This is another area that people can carry a lot of tension without even realizing it. Oftentimes, our biggest complaint is the neck and shoulders because those are the areas that can hurt. But the entire spine is connected. So you'll notice that the low back can carry a lot of tension as well. So I'm repeating basically the same Swedish maneuvers to warm up the muscle tissue and to take an inventory and see where the tension is. So if you feel where your partner's spine is, and move just to the outside of the spine, you'll feel a band of muscle tissue that kind of dips off and becomes soft. This band of tissue is called the quadratus lumborum. It's a big fancy name, but we just call it the QL for short. But it is a big, hard worker and can carry a lot of tension. It can get really stressed out and tired. So if you come to the outside edge of the QL, you can really apply a good amount of pressure and start to loosen up the muscle. So I'm using my thumb here, making small circles with my finger. And I've noticed that there's a little knot here, a little point of tension, a little trigger point. So I will isolate that spot, just working it, inviting it to loosen and soften. And so the places that you have to isolate, the trigger points will be different on every person. So if you're following along to this video, don't expect that your partner will have the same trouble spots as Corrina. It's good to massage lots of different people because it will help you to identify the different places that different people carry tension. Another area that can often be tight is the top of the hips. So you can access the hips and start to access the glutes even while your partner's back is uncovered. So you don't have to reveal anything that would make your partner feel uncomfortable. You can work this area right where you are. And I recommend spending plenty of time doing the warm-up Swedish techniques because our glutes can get very tight and can be very sensitive. So you don't want to just charge in with some deep tissue right away, but it's better to take your time, warm up the tissue, and gently, slowly start to work into the areas of tension that you detect. So Corrina is actually doing pretty good and doesn't have too many trouble spots in her hips. But there's a little tension here that I notice. So as I start to move into the deeper work, again, I'm still using more than one finger. I'm using the flat part of the finger pads so that I slowly and gently start to work into the muscle tissue without jabbing or poking or creating any discomfort. And using both hands, one hand stacked on top of the other, allows me to apply more pressure without actually having to work any harder. Work smarter, not harder, right? And after you've worked into the glute, you'll return to your broad Swedish strokes to smooth it out. And one technique that feels really good, if you come across the body, just gently slide your fingers from the side back in towards the middle. It's very soothing and relaxing, not using very much pressure. This really stretches the skin and the fascia in a way that's very soothing and relaxing. Before I move to the other side, I like to take some time to work into the tops of the shoulders and the neck. So just using my hands as if I'm kneading dough, I can massage the tops of her shoulders here, right across the top of the trapezius. That gets really tight. Again, if you notice anywhere that's particularly tighter than another, you can spend a little extra time there. And you can take this same approach all the way up into the neck. So I'll move her hair out of the way so it's a little easier for you to see what's happening. So I'm just picking up the muscle tissue just to the outside of her spine and gently rolling it between my fingers. All the way to the top. And glide my hands down both sides. This is a nice chance to reconnect with the opposite side. Warm up those muscles and if they got a little cold. And this is a nice way to transition to the other side. So if you haven't already, go ahead and favorite this video so you can come back and follow along on the other side. Again, using the Swedish techniques to warm up the tissue and using the deep tissue techniques to target those specific areas of tension. Thank you so much for following along with me today. I hope this information has been helpful for you. Don't forget to subscribe to the Psychetruth channel so you have access to this complete series of deep tissue versus Swedish techniques. And if you'd like to learn more about me and my practice, visit jenhilman.com. Thanks for joining me today.